Strategy number 12. Use Maslow's hierarchy of needs. What if there is no airway compromise and no breathing difficulty? The ABCs don't always apply. For those situations, there's Maslow's hierarchy of needs. Use this framework to help set priorities when you must choose between different interventions, assessments, or which patient to see first. Maslow's hierarchy of needs. 1. Basic physiological needs should always be addressed first. These include airway and breathing, oxygen therapy, circulation, IV hydration, nutrition, and elimination. Included here are actions addressing critical lab values, pain management, dehydration, etc. 2. Safety and security come next, including promoting the nurse-client relationship, protection from injury, feelings of security, and outpatient referral needs. Included here are actions addressing safety, less critical lab values, risk prevention, non-skid socks, bed alarms, transmission-based precautions. Note: the next three are usually addressed only in questions about psychiatric nursing or therapeutic communication. Examples of therapeutic communication questions STEMs are: which of the following would be the most therapeutic response? Or, which response is an example of reframing? 3. Love and belonging. Love and belonging is third and involves the client's need to have support systems in place to feel cared for by family and friends and to avoid isolation. 4. Self-esteem is about feeling competent to make decisions, feeling an internal locus of control, and a sense of self-acceptance and worthiness. 5. Self-actualization is the last priority and is about encouraging the client in the development of their own spiritual or psychological well-being, growth, or creativity.